Currently, tens of thousands of active COVID-19 cases in the Western Cape. The healthcare system there, of course, under heavy strain. The province's Premier, Alan Winde, has announced that tests for the virus will be rationed in Cape Town.
That's due to the high demand. Winde says authorities want to ensure that testing is reserved for high-risk situations. Let's speak to the Western Cape's Health Department head, Dr. Keith Cloete, to understand how this process will work. Many thanks for your time, Doctor. Let's get an understanding, a basic understanding of how exactly you plan on rolling out this particular process.
Just to clarify to you, good evening and good evening to your viewers. We have been doing this for the last week, and it's basically from the premise that there is so many people coming for testing, both in the private and the public sector, that the capacity to be able to produce the results in the desired time frame is now being compromised by the high volumes of testing. So what we are implementing, specifically in the Cape Metro, is to make sure that the people for who we need the test most urgently can get the test as quickly as possible to be able to enhance their treatment options. This is something we did in the first wave as well, but this time the volumes are much higher, and it is something that we now need to do to safeguard the ability to test. And these are, firstly, people that present to hospital that has symptoms that we need to confirm the diagnosis in. We need to get their test as quickly as possible. The second group is people that live in old age homes or in group facilities. Then there's a group of people that are vulnerable, that has comorbidities. And then there's the healthcare workers, obviously, and people presenting to the healthcare facility for surgery, and then they need the test before they do that. And then lastly, if somebody has passed away and they've been symptomatic, we have to do the test on the bodies as well. So the people that we are therefore saying that are at lower risk is anybody below the age of 45, somebody that does not have a comorbidity, and somebody where there is no symptoms of severe illness.
So let's talk about some experts saying that we're not testing enough. This, of course, will add to that opinion that you're not testing enough because you're saying you have to ration the process due to the numbers you're seeing. The impact this, of course, has then is on identification of those who have COVID-19, which will ultimately lead to it spreading.
Yeah. So when your case positivity rate, and this is a very important factor to consider, our case positivity rate at the first peak was 45%. That means for every 10 specimens we send, 4.5 of them are positive. Or for every 100 you send, 45 is positive. We are now approximating with free open testing for everybody, 1 in 2 tests to be positive. When you get to test positivity rates of that level, it means that you are not testing enough anyway. That means you must test 10 times more people. Our situation in South Africa, we'll never be able to maintain test positivity rates to below 20% or 10% at the peak of the rate of how the infection is spreading. So even in the first wave, everywhere in South Africa, when the test positivity rate goes above 30, 1 in 3 positive, above 40, 4 out of every 10 tests being positive, you are not testing every single person that is COVID positive. So we're not testing the people anyway. What we're doing here is we're changing a risk stratified approach to testing, which is testing to influence our treatment options in terms of giving people the best possible outcomes.
Right, so you've described the plan quite clearly when it comes to testing and the rationing of those tests there. But another important thing we're going to have to consider as more and more people come out COVID positive, the bed space in the region. And I want you to talk us through the department's plan to making sure that those who really need a bed get one.
And that is also part of where we are and why we're taking this decision. Because if you just listen to what I said, the people that is going to need a bed, they are going to fall in the categories that we are still prioritized to testing. So therefore, we are focusing for people that, in a sense, would need oxygen and a bed. At the moment, we have more than 3,200 people that's COVID positive in private and public hospitals currently in the Western Cape. About 1,800 of them are in public sector hospital beds, and the other 1,300 is in the private sector hospital beds. Both private and public sector hospitals are under severe pressure for these beds. What we've been able to do in the public sector is we've taken all the beds that is not for maternity, not for pediatrics, not for psychiatry or TB, and in those beds, we have de-escalated all other care to enable us to provide more capacity for COVID. And in addition to that, we have brought field hospital beds online to the tune of 613 additional beds in the metro. The last 180 of them are coming online in 4 days' time, and then we are moving towards what we expect to be a peak. It's the first week in January, when we've added additional 187 beds, together with the fact that we create capacity on an ongoing basis in our acute hospital capacity to be able to cope with the beds. Our biggest rate-limiting step is not the bed. There are two factors that we are very acutely aware of and managing at this point in time. The one is the availability of staff. We have 900 of our staff members as currently actively infected. 70 of them had to be admitted in the last 14 days. Unfortunately, 6 of them died in the last 14 days. So there's a huge strain on our healthcare system from the point of view of available staff to be able to do the work. But the other big one is also the availability of oxygen. So both of these we're managing now as a scarce commodity, staffing and oxygen. So staffing, we're getting every single possible person we can get onto contract online. We brought 47 people online in the last 4 days. We hope to bring another 400 in the next week. And then in the first week in January, we hope to bring an additional 400 people online in terms of staffing.
And just pick up again on the oxygen. How much do you have? Do you have sufficient oxygen? And what about ventilators? Because you mentioned 3,200 patients in hospital right now being treated. But do you have enough oxygen and ventilators?
Okay, so let me just start off with oxygen. And we got a very sophisticated engineering team that has given us now oxygen utilization almost to the hour per hospital across all our public sector hospitals. So the team has done phenomenal work. We got a dashboard we can track. We know exactly which hospital is under pressure for oxygen use and for oxygen supply. We've also worked with AFROX. AFROX is the big supplier for oxygen in the Western Cape. And AFROX is now increasing their capacity to meet our increasing need. So at this point in time, we have sufficient oxygen. We are working with AFROX to get additional oxygen. But the most important thing is we are now managing our capability to be able to manage oxygen. That's the reticulation system, the points, and we're bringing additional high-flow nasal oxygen points into the system as well. So we're managing this very carefully. We're titrating the need versus demand and making sure that we look after our oxygen capability. In terms of ventilators, out of the 3,000 people that I mentioned to you that are in hospital for COVID, 380 of them currently are in ICU capacity, and many of them are on ventilators. So that is public sector and private sector together. And in terms of that, 80 of those 360 is actually in the public sector. So those beds are under pressure, but we do have some capacity for COVID. And you must remember that we also have now competing trauma still in those beds as fueled by alcohol. So those are the things that we're dealing with at the moment to manage oxygen capacity and our availability to have access to high flow nasal oxygen and then very, very pressurized ventilated capacity in ICU care.
Very quickly, can you tell us about the Garden Route, of course, declared a hotspot area? How's the infection rate there now? Have those measures actually helped decrease?
We can confidently say that Garden Route now for a week, and it's constant, has had a reduction in active cases. There's also been a reduction in the bed occupation in our hospitals. So we've had a week. They've had their peak. They are coming off a peak, and it is declining all the time.
Thank you very much. That's Dr. Keith Cloete sharing insights with us on what's happening in the Western Cape.